Good afternoon. We're live from San Diego, and we're talking today with Dr. Cassano. And Dr. Cassano has an expertise in environmental science, really dealing with toxic exposures. So I'd like you to start off by telling me about your educational history, if we could start with that.
I went to college up in Westchester and then did graduate work in human genetics at Columbia, and then decided at that point I had a choice of where to go to medical school, and I decided to do the Uniform Services University of the Health Sciences, which is a medical school for all of the, not only the armed forces, but also the Coast Guard and the Public Health Service.
And so after you completed all your medical training, were you in the service for a period of
I
time
was
as well?
in the service for 24 years.
Okay.
I first trained as an undersea medical officer, which included diving and submarine medicine, and then did my residency at the University of Michigan in Occupational and Environmental Medicine.
Okay. So I'd like to sort of focus on the occupational environmental medicine, because a lot of our service men and women have been exposed to things depending on which period of war we're talking about, correct? Mm-hmm. The last topic I want to talk about is the Camp Lejeune.
Okay.
And so we now have these presumptive conditions due to the exposure in the water. Were you involved at all in any of that being promulgated?
God, I'm thinking back. I think I was at the very beginning of it when the whole Camp Lejeune thing came up, and I did help evaluate some of the literature. I think I was back over at DOD when the presumptions got promulgated.
So are there, in addition to the conditions that are on the list, are there other things that you believe could be caused by Camp Lejeune that VA doesn't recognize as presumptive? I guess that's really the other question.
Certainly. I mean, first of all, there were 15 conditions on the list that ATSDR put out, and then subsequently Academy of Medicine put forward as limited or suggested evidence of causation. Definitely TCE and PCE. Now, I think bladder and excuse me, I'm getting confused when and stuff.
Okay.
It's either bladder cancer or kidney cancer that is presumptive.
Right.
From my perspective, I can make a case for either one.
Okay.
That's one. The other one is, I think, immunological derangement. And you see that both on the immunosuppression side and on the autoimmune disease side.
So give an example of an autoimmune disease.
Chronic inflammatory demyelinating polyneuropathy is one that I have, on a case-by-case basis, done a medical opinion on. And scleroderma is presumptive. Scleroderma is an autoimmune disease. There's very little difference in how one autoimmune disease is caused versus other autoimmune diseases. It happens to just be the target tissue that may be different. Okay. So depending on what the autoimmune disease is and what kind of literature is out there, you can sometimes make a good medical nexus. I cannot do it for systemic lupus erythematosus, SLE. Yeah. There's just too many competing factors in there and too many variables to be able to do that.
We really appreciate your time, so thank you.
It's been fun. Thank you. Appreciate it.